And for the next topic which we are going to discuss, we'll talk about what is known as a fistulous tract. Fistulous tract. So what is a fistula in the first place? A fistula is an abnormal communication between two epithelial surfaces. So it could be that your intestines are communicating with the skin on your stomach, leading to what? Substances from the intestines leaking out. It could be that your rectum is communicating abnormally with the skin outside, leading to your feces leaking out on the skin in an area which is outside the anus. It could be that the bladder is communicating with the vagina. It could be the bladder communicating with the uterus. Different types of fistulas. So most of these fistulas, they form tracts. But they form tracts when they communicate with the skin. I don't know if you understand. Fistula could be one organ communicating with another organ, and everything is buried inside. But when a fistula is formed between a particular organ and the skin, it forms a fistula. It forms what? A tract, so that things could leak out on the skin, right? So a fistula tract, you have a very beautiful picture here, which is trying to show anal fistula. Okay, and you can see the external opening is actually the tract that I've been talking about. So what is a fistulous tract? It's an abnormal channel or passage, and it develops between two epithelial surfaces. Okay, well, the fistulous tract, right? Sorry, let me correct myself. Even when it forms between two organs, it's still a fistulous tract. Substances leak from one organ to another, it's still a tract. Even when it forms between the organ and the skin, it's still a tract. Sorry for that mistake. So, it's a channel or passage that develops between two epithelial surfaces, that's between two organs or between an organ and its skin. So it allows fluid, pus, or other materials to now drain through that pathway. But that pathway is not a normal pathway. It wasn't meant to be there. So types of fistulas, we have the external fistulas. This one connects an external organ to the skin surface. We have the internal fistulas. This one is between what? Two internal organs. Okay. So causes could be due to infections or abscess. Could be a trauma or surgery. Yes. Somebody did a surgery for a different thing, but he injured some organs in the abdomen. Then before you know, they were communicating. It happened last 2 years in our hospital. Okay. It could be inflammatory diseases. It could be malignancies. It could be what? Congenital. You're just born with a fistula, like the tracheoesophageal fistula. So clinical features is that there's a lot of persistent drainage. So depending on the substances found in those organs, it could be pus, it could be stool, it could be urine, other secretions, pancreatic fistulas, and the rest of it. So there's pain and discomfort, there's recurrent infections, there's skin irritation around the external openings. Okay, also functional problems. Alright, so right here on my screen, I'm trying to show people the enterocutaneous what? Fistula, where there's an abnormal communication between what? The intestines and the abdomen, mostly the small intestine. So diagnosis, clinical examination, fistulogram, contrast studies, CT and MRI for internal fistulas, endoscopy for gastrointestinal fistulas. So management, you have to control infection, because imagine there's a fistula between what? The rectum and the vagina. Guy, feces are now getting into the vagina. I've seen cases like that, many. Alright, so a woman is passing stool through the vagina, and if somebody came to the hospital and she has been passing stool through the vagina, I think it was a small girl, she was around 6 years, but for 6 years, guy, she has been passing stool through the vagina. So control infections, nutritional support, wound care. Right, then surgically you cut out the tract, then you what? Suture. Okay, you close it. So they also manage the underlying conditions. If the person has any other underlying disease condition that is basically causing the fistula, I try to